Sudden cardiac arrest kills around 30,000 people in the UK a year. A sudden cardiac arrest is when your heart stops. When someone's heart stops, in around 85% of the time, it goes into what's called VF, ventricular fibrillation. You might have heard on medical programs on television where they say someone has gone into VF. This is the abnormal twitching of the heart. The heart is quivering but not actually pumping any blood. The person is effectively dead. If you leave this person, they won't die, they'll stay dead. The first aid treatment for cardiac arrest is CPR, cardiopulmonary resuscitation. This is a cycle of compressions and breath to try and keep the brain oxygenated until advanced help arrives. What we're going to try and do with CPR is to massage the heart by pushing down on the chest, which forces blood out of the heart and around the body. When we release the chest, this will suck blood back into the heart, ready for the next compression. When we do breaths, we're circulating more oxygen into the lungs, which can then be pumped around the body. CPR will not bring this patient back to life. That just cannot happen. What we need to do is to activate the emergency services very quickly, and they will bring what's called an AED, which stands for an automated external defibrillator, and hopefully they can revive the person. The problem from the paramedics' point of view is if effective CPR is not delivered or no CPR is delivered, the patient's chance of survival is very small. In only around about a third of cardiac arrest cases does someone even attempt CPR. So if you could just try and do CPR, this person's chance of survival will be increased, as their chance of survival is dropping by around 10% every minute before the AED arrives. With an ambulance call out of around about 8 minutes, the chances of survival are quite low, but delivering CPR will increase the patient's chance of survival by keeping the brain oxygenated. In this scenario, someone has gone into cardiac arrest. Safely approach, introduce yourself and ask if you can help. This gives you consent. Even if they don't answer, tap their collarbone and try and gain a response. Shout for help. It may be someone hears you and can come and help you. Next, check if they're breathing. Place one hand on their forehead, the other one on their chin, and tilt the head back to open the airway. And listen for breathing for 10 seconds. If they are not breathing, send someone to call the EMS. If you're alone, make the call yourself. Use your mobile phone on speakerphone so you can still deliver CPR while making the call. If you're sending someone to make the call, be clear in what you want. Tell them, can you go and dial 999, ask for an ambulance, then tell them you've got a non-breathing patient and you're delivering CPR. Tell them exactly where you are, and then tell them to come back and tell you what the EMS have said. It may also be worth asking any bystanders if there's an AED locally, as they're simple to use and they talk to you, so they can tell you exactly what to do. AED units are becoming much more available in the community, and using one could massively increase the patient's chance of survival. Next, start CPR with chest compressions. Take the heel of your hand, interlock your hands together. Push down on the center of the chest 30 times at a rate of 100 to 120 compressions a minute. That's around about 2 per second. You need to push down 5 to 6 centimeters and make sure you fully release to allow the blood to get sucked back into the heart. Once you've delivered 30 compressions, open the airway with one hand on the forehead and the other one under the chin. Squeeze the nose and deliver 2 breaths of around about 1 second, just until the chest rises. Then deliver another 30 compressions and 2 breaths until relieved by the EMS. CPR is tiring, so if possible, swap over to a second rescuer every 2 minutes. CPR is straightforward and is vital to try and keep the person's body in a state where the professionals can revive the patient.